The usual way, if you do have a question, please try and stop me and ask your question. I think I prefer that so that it can be interactive. Thank you. Okay, so we're to talk about musculoskeletal disorder tonight. I'm Dr. Salau, I'm a GP, Douglas Grove Surgery, Witham. Please, next slide, please. Right. So MSK, it's a musculoskeletal disorder, and there are injuries or disorder that affect the human bodies. This could be your muscles, your tendons, the ligaments, nerves, discs, blood vessels. It's like anything that supports the skeleton, the bone, the main frame of the body. Any kind of disorder that affects them is what is referred to as musculoskeletal disorders. An example of musculoskeletal disorder is anywhere there's a joint, problems there. And when there are problems there, we refer to them. So let's start from our hands, for instance. We have carpal tunnel syndrome. I've deliberately picked out some things here because of the age group, this age group, over 50s. Because these are things that usually happen to people as we age, and we need to be aware of it and know what to do. Carpal tunnel syndrome, it's in the wrist joint. We use our hands a lot, and at the joint of the wrist, where all the tendons that supply, that control the fingers, they come right from the forearm into the hands. There is a little bit of a flexor sheet that kind of trap them. They put them under kind of trap those tendons. They pass underneath the flexor sheet. So when you have a swelling around that area, it will irritate the nerves that's passing underneath. You start having tingling and numbness in your hands. This usually happens when you are resting at night, when people are sleeping. You know, they just wake up at 3 o'clock and they just have to shake their hands to get rid of this feeling, sensation. That's what we call carpal tunnel syndrome. That's the early stage. And as it progresses, then you start having it during the daytime. You just have a feeling of a burning sensation, tingling, severe tingling in the whole hands or 3.5 of the fingers. It depends on which nerves is trapping. There are many causes for this carpal tunnel syndrome. The commonest, well, the first and foremost, we said we don't know why it happens. People just get it. That's the commonest. And then the other ones is when people are having any kind of fluid retentions, like you're taking some tablets that is causing fluid retention. If you're using your hands a lot, you're using carpal tunnel syndrome, it can be induced by repetitive training, which is putting pressure on the hands. So that's carpal tunnel syndrome. It can be treated, but we go to the treatment later on. The next one is tendonitis. All the tendons, the ligaments that control the fingers, the tendons that control the 5 fingers, they could get inflamed. That's an inflammation, and that could be due to repetitive training as well. So when you put the muscles under the tendon or the muscles under stress, they will tell you, back off, you're doing too much, stop. If you're not doing that, then they become inflamed, and then it leads to problem. The next one is muscle and tendon pain, which we described. Muscles could get under inflammation as well when they are being unduly used or exerted. Then we have the ligaments. We can see we're talking about the same things. You know, the main things, you have the muscles, you have the ligaments, you have the tendons, they're all encompassing. These are the structures that keeps the joint stable. You have a tiny bone that is supporting the whole body framework. Those bones are not they are not heavy to support our frame. So, but you have all the support network of muscles, tendons, and things, and this is where the problems are coming from, mainly. And then we have the neck syndrome, tension neck syndrome. You have a tiny neck supporting a big head. The skull is quite heavy, and it's being supported by a very, very tiny spine from the neck. And you could imagine how is that happening. So all the structures, the neck muscles and all those things. So that could lead to tension neck syndrome. And if you come down to your elbow, you have epicondyle. Epicondyle are the edges of the elbow. There is both sides. There is lateral and the medial side of the elbow that is called epicondyle. Those places can get inflamed. The reason for that is they have attachment of muscles around that area. The muscles that controls the hands, the forehands, and everywhere. They pass through that area, and they could get inflamed and get really, really sore and painful. And going back to the hands, we have our fingers. We use the word finger. As people get older, the fluids between the joints, they kind of dry up. They are not as liquid or as they used to be. There isn't much lubrication there, and it could get to a point that it seizes up. You wake up and then you have to flick the finger to straighten it. Once you kind of bend the hands, you have to use your hands to push it up to straighten the fingers back. You use the word trigger finger, and that's quite common as people get older. And don't forget mechanical back pain. And that's the same thing as in the neck. You have a tiny spine supporting our back, and a lot of people present with, very common in their practice. Quite a substantial number of patients present to their doctors with back pain. It's got to the point now that the doctors are even saying, right, we do not want to see back pain anymore. When your 20% of your consultation in a day is back pain. So we have to contract it to other people to deal with it because it's just applying unnecessary. But we'll talk about that more in detail. And then the final overall thing is the disc. It becomes degenerative, which is the daytime is wear and tear of the disc. Disc has been there for ages. As it ages, it gets worn, then it becomes degenerate. More about
that. Doctor, do you have a headset at all, or something that you have that you can use?
Is there a problem with the volume?
It's kind of echoey feedback from you, but if you don't have it, let's move on. I think
no,
it's okay.
with this the posh thing that you gave me, this laptop. Sorry.
Okay, let's move on.
Let me try. Yeah. So if you see the picture I have here, sorry, let's go back. Yeah, if you look at the pictures here, the shoulder, the neck, you could see the fire, the kind of inflammation. These are inflammatory changes that is going on in that joint in the area. We'll revert back to all these pictures later on. Right. So what causes these disorders? As we said, they could be through sporting activity, or through the job we do, or even at home doing nothing. People can have injuries. In sports, any kind of sports could lead to injuries. Contact sport, it could be non-contact sport. You could see someone that play golf. They are prone to injuries. The way they portray themselves, they do everything. You now say, well, you wonder, any sportsman needs to be physically fit and sharp, and be ready to do any kind of sports at all. If you're not fit and you do things that you're not supposed to be doing, that will result into injury. It's very important that we that anything could lead to injury. Now, at work, you just say, all right, I'm doing nothing. Why is my back hurting? I've not done anything. I've not had a fall or something. When you are at work, you're sitting down for hours. You're not even getting up from your chair, and you're not moving around. Your back will seize up, lead to injury. If you're not putting like I'm doing now, if you stay in this kind of position, your desktop has to align to your eye level. There's a kind of recommendation that you need to be there so that you put your neck in the right posture and position. Once you're not doing that, it leads to injuries. And you just say, oh, nothing happened. I just woke up this morning. I'm having all these aches and pains. Probably when you look at the history properly, it's better to what we're not doing right. And repetitive straining from long-term use of keyboards, using your computers all the time, they are. And then we talk about domestic. In our house, you have poor lighting. You just wake up in the morning, you're trying to go to the bathroom, you cannot see very well, you trip, all those things lead to injury. And the floors are wet, slippery floor surfaces, like bathrooms, you have water, you get into the bath, people sleep, leading to. Next slide, please. Right. So I particularly feel back pain here. Like I said, it's significant presentation to the primary care doctor practice. And as like I said, as we get older, the back is under a lot of pressure, and they get inflamed. That's a very good description of what goes on there. So please, we move on. Back pain could be the first version of something nasty. So not just, oh, I have a back pain and you just ignore it. Especially when you're at our age group. If you having back pain, let's say from a younger age, and that's your typical back pain, that's fine. But suddenly you start having back pain, please do not ignore it. You need to seek advice. And what the doctors will do is to go through some questioning. Because a back pain could be a presentation of something nasty, like prostate cancer. Back pain, metastasis back. Here's a sign of insidious in illnesses like tuberculosis, be an abscess. Any of those is important that you. What the doctor will do is to make sure that we do that. We call that hygiene, questions. We pick the ball. Even the pharmacist could do that. They will ask you some questions. And when there's an alarm sign that there's something sinister going on, and further investigation, granted, we need to do that. You have to be concerned. Some of the alarm symptoms that we're worried about is severe pain in your back that is kind of disabling. You're not able to move around, not able to move your legs. You have radiation, it's shooting down to your legs. You're having pins and needles or numbness, loss of bladder or bowel, control of the bowels. You have to call 999. That's what we call acute cord compression, which could happen. The cord just crash, it collapses, and it will trap all those vital nerves, by the legs and perineal organs. That one, they have to treat you within 6 to 12 hours. They try to get in quickly and fix it. That's an emergency surgery. So if somebody is in excruciating pain that they're not able to move around, shooting down the legs, they're feeling numb in their lower legs, please 999.
Now, what kind of surgery though are we talking about in this case?
Yes, it's called spinal decompression. Spinal decompression surgery. That's what they do because like if you look at the, let's go back to the picture of the back in the previous picture that we showed of the back. If you look at closely to those bones, you could see kind of like they look cobbled, all those stones like aligning, they're kind of overlying each other. Mm-hmm. Those are the bones. In between them, you've got discs, you've got cartilages. Those are soft tissues. They are in between the bone. Those are where all the vital nerves and vessels, blood vessels, they come out of that place to supply the legs to keep us moving. That's where they come from. Now, when there is an accident, there is a crush, they overlap, the one vertebrae is crushing on the other one underneath. That could happen. When there's a disc herniation, that disc will just collapse, will get out of where it's supposed to be, and the bones at the top, they will be crashing onto the adjacent bone. You are in trouble. And that's what we call spinal cord compression. And they need to go in to free all those nerves from being compromised because they would strangulate. It would strangulate them.
So do they put something in between to then create a gap back again or what?
Well done, Professor Eni. It depends on the degree of the collapse. Yes, they can do that. They can put a metal plate if necessary. It depends on how bad the degree of injury is. Now, this gave me the opportunity to talk about what we call osteoporosis. Osteoporosis is brittle bone. We stay on this slide to talk about it. Osteoporosis is brittle bone, like the bones is just hasn't got any calcium in it. Enough calcium. You need a lot of calcium and vitamin D to have a good bone strength. As we live in this temperate climate here, we're not getting enough sunshine. We're not getting enough vitamin D. But it's advisable that every one of us should be on a 1,000 units of vitamin D every day, irrespective of what your vitamin D level is. Just get your vitamin D 1,000 units every day to maintain a balance. If you're deficient, you need more than that. You need about 50,000 units a week for about 6 weeks, 4 to 6 weeks to correct your deficiency. Once you've not corrected your deficiency, because your doctor will do a vitamin D, you just, they'll check your vitamin D level anyway. Anybody who's having some pain, check your vitamin D. Or when you're having your annual check, ask your doctor to check your vitamin D. Because we're not absorbing enough vitamin D due to our skin colors. Our vitamin D is stopping that from happening. So we do not have enough sunshine. So there is a lot of problems with the absorption. So once they've done the vitamin D level, they'll give you a dose. Those are the kind of dose you won't be able to buy over the counter. Like I said, it's 50,000 units for about 6 weeks, 4 to 6 weeks, depending on how low your vitamin. And once you finish that, you go on the maintenance so that you do not slide back. Deficiency of vitamin D could lead to aches and pain, bone pains. Those are one of the features. So we've talked about osteoporosis now, like as I was saying, when you now lack vitamin D aids the absorption of calcium. They travel together. When you lack vitamin D, you are slowly losing calcium, not having enough calcium as well. So if you're not having enough of those things, it leads to brittle bones. And the other things that lead to brittle bones as well is smoking history. When you're too slim, lean body mass, one advantage when you are big, you're probably those things. Sorry, go on.
Yeah, Dr. Fatai, sorry, this is Debeji.
Yes.
So, question regarding calcium. Now, from my limited knowledge of biology, we get calcium from dairy products. But as we get older, they said we should not be taking dairy products anymore.
That's right.
So where are we going to get the calcium from?
Exactly. Thank you. You don't get those, you get the most significant amount of calcium from dairy products. Thank goodness the kids that need a lot of calcium, we give them dairy, we give them milk. I wouldn't use give them milk, which is the highest source of calcium. There are other sources of calcium, like fish bones, that we eat. Some vegetables, you'll be surprised that they have them. So yes, if you go online, sources of calcium, they're not as high as in dairy, but you still absorb calcium from other food bones and things like that. Now, when you take vitamin D, the body, like I said, it promotes the movement of calcium. So the problem is absorption. So that the little amount of calcium you need, once you absorb those, the rest are wasted. So if you're having enough adequate vitamin D that promotes the transportation of calcium to your bone, that's fine. And that's why we encourage people to take vitamin D. So if you're taking vitamin D, you'll be rest assured that you are taking it will help you with your calcium. You don't need tons and loads of calcium at our age. You need it when you are younger, because that's when metabolism is high. Your bone, your bone mineralizations is so high. You're developing, you're growing up to the age of 21. So for men, so it's that's when it's hiding it. At our stage, what we need to do is to maintain that balance. What you've gained from childhood to that age, for your teenage years, you need to maintain them. So you maintain your bone strength. How do you do that? Adequate nutrition, adequate exercise. All those things will maintain the bone strength, not losing the bone. Yeah.
Okay, thank you. Chidi has raised his hand. Sorry, Chidi, please. Chidi, are you there?
Can you hear me? Sorry.
Yes.
Yeah, thank you so much, Dr. Fatai. It's always a pleasure, listening to you. And very good question from Chief Alhaji Dimeji. We need to be very careful with the calcium, like Dr. Fatai said. I know there's a lot of promotion for milk, but actually, where is the milk from? I heard it's from cow. Is that right? Mostly.
Yeah.
Where does the cow get it from?
Plants.
From plants. So, and I think people will say this. The key sources of calcium, you'll be looking at spinach, interestingly, and just there's a statistics and a research by Harvard. When you look at the countries that drink the most milk, they are the countries suffering most from bone problems. The highest hip replacements happen between New Zealand and America. So I think we just need to be cautious about the marketing of milk for us. Only human beings still go and breastfeed from animals in their adult age. So we just need to be careful about that. Thank you.
Thank you very much, Chidi.
Good, Chidi. Thank you.
Kenny, my screen is blank. Can you see me? I can't see anything.
I can see you.
Okay.
Can everybody see you? Can you still see the screen?
Oh, it's just
gone blank. Okay, what you need to do is just press any button on your computer.
I've done that. Just okay. Yes, I'm back. Thank you.
You're back. Okay. Okay. Tech support. No problem.
All right. Yes. Thanks. So
next
yes.
Slide.
Next slide. Yes. Yes. So much to talk about regarding back pain. We've talked about osteoporosis, and we've talked about the nasty growth, things that we should be careful to make sure that it's not a serious illness like TB, abscess, or cancer and things like that. Talk about that. And yeah, if somebody is losing weight and they're having temperature, night sweats, and they have back pain, please do not ignore it. They need to go and get checked, because there are some cancers like myeloma. Because of our age group, there's so much to do with cancer, I'm afraid, and we need to exclude. Very, very vital. Next. Right. I think I'll probably be going back to what we've said before. If there's a need for one. So yes, we're talking about the treatment of back pain now. So I think the best form of treatment is prevention. Most of back pain can be prevented. We could stop ourselves getting injury or lessen the amount, the kind of injury we sustain if one happened by accident or something. You need to understand your environment. We need to understand the limitations, our limitations as well. As you get older, you have certain things are just not for you. You see a 70-year-old man climbing a ladder. You have to be very, very careful because if anything happens, how do you balance yourself? It's just how your reflexes and everything falls into the serious injuries. Your environment, your limitations of what you need to do, very, very important. Right. How does injury occur? It's when there's an imbalance. When there is a tiredness of the muscle. Let's say you carry something now. You carry something. You stretch your hand and you carry something very heavy for a long. The muscle will get tired and fatigue. If you do not drop that thing, then you'll lead to injury. So muscle fatigue could lead to injury. Poor work practice, like you mentioned earlier on. You sit down, you want to do all the job, you're sitting for 6 hours, you're not getting up your feet to walk around, to stretch your back, you're killing yourself. You need to stretch your knees, you need to stretch your joints. Human beings who are not designed to sit down. You are designed to wake up in the morning, go and keep going around till you're tired and you sleep. That's what we are for. But now, with technology, with what we do now, people just sit down, and sit down. That's just not what we're meant to do, and it's public now. What else? Poor nutrition, very important. I don't like food, I'm not eating. It's very important you maintain a healthy diet because the muscles, they need glucose. They need a lot of energy on the task. If you look at Formula One drivers, if you look at the fitness regime that they have to go through, it says all you do is sit down and drive a car. Why do you need to go through this kind of fitness regime? You're sure, what sort of injury that could occur to someone who sits down there and being thrown around with all the centrifugal forces and all that. Please, your fitness is very, very important. And fitness to me. Stretches. It doesn't have to be like you're doing marathon or rigorous exercises. Even Pilates, yoga, all those things, very, very important at our age group. Just keep those joints moving, keep them moving so I don't get stiff. They're not moving, they get stiff. When you get stiff, you're very easy. When we talk about think before you lift anything, at our age, lifting is something we should be very, very careful. In fact, someone says, do not lift anything more than 30% of your body weight. You are doing that, you're putting yourself in. But lift it, you have no choice. You need a technique. These techniques are available online. All you need to do is please stop bending that back. Use your knee. Go down on your knees, do the lifting. Let your knee do the movements, not that tiny whip that you have on your back. Your back is a whip. It's so tiny, it's so small. That supporting so much. So respect your back, use the knee, do all those things. I think we've talked about that. Now, when it comes to acute back pain, that's the one we're talking about now. There are two types, acute and a chronic back pain. Acute is sudden onset and it's out of the blue, debilitating back pain. That is the kind of pain that we think you need to see a physiotherapist, occupational therapist, osteopaths, chiropractors, people that do acupunctures. You could see them for it. It's okay. You treat yourself for it because the earlier you seek treatment, the better. Because if you not do the treatment quickly, it could lead to a chronic back pain. When you get to the chronic back pain, that's it for you. You'll be very lucky to get out of it. That's it for life. So get the treatment needed immediately. And the treatment needed is when you have a back pain and it's not gone within 5 days. I'll say 5 days and it's still lingering. Please just look for a good physiotherapist or chiropractors or osteopaths. They will maneuver the back. They know what to do. Very, very technical. They will stretch the back, they'll put it back in place, and you'll be as good as gold. You might need a few sessions, but they do that. If you have health insurance, your health insurance will pay for that, which is good because they are not cheap. They're quite dear. NHS will not offer you, they'll offer you That is not great. This stage, we treat ourselves, please, and have access to good physical chiropractor. It's not limited to back pain. Any MSK at all, they can bill. And the good thing about it, when they're suspicious of something nasty or sinister, they are trained, they are highly trained. They spend years going through this training themselves. They will send you to your GP immediately. This pain is not just a soft pain. Your GP would do a scan, MRI, send you to a neurologist, neurosurgeon or something about the problem, orthopedic surgeon to fix the. Do not ignore things. There and it's dragging on for more than 4 or 5 days, please. Right. Next slide. Is anything we're talking about again, please?
No.
Okay. Wow. Thank you. I think that's me done.
Okay. Thank you very much, Doctor.
Thank you.
Everybody, you can unmute now, and I'll stop the recording so that we can have a question and answer session.